Hi guys, my name is Amanda Ray and I have rheumatoid arthritis, RA for short. I want to clear up the confusion. RA is not an old person disease. It can affect anybody, any age, women more than men, but it can affect anyone. I am a mother of two amazing boys, Kale who's 2.5 and Caden who will be 11 next month. I was diagnosed with RA when I was 19. I was a dancer, a gymnast, a cheerleader, clear up until a year and a half before I started feeling symptoms. And then a few months later, I was diagnosed with RA. RA affects the body, the joints. It's the body attacking the joints. It's causing damage to them and it's eating away at them. It will cause deformities, and in some people, it can disable them, so they have to use a wheelchair. A lot of doctors put patients on Humira, Enbrel, Cimzia, Xeljanz, methotrexate, all of these medications to help try to control it. I have been on all of them, and they have all failed for me. So I have decided to take a new light on this and try to control it with diet and exercise. And I am going to be posting a lot of videos with recipes for inflammation to help with the pain and different tips on how to manage the pain and great exercises and just kind of my family life and how we all deal with the RA. So I guess it's kind of like a lifestyle channel, if you will. RA affects the body in many ways, and it also affects the mind. When it affects the body in the morning times, which is the worst, you can have a lot of morning stiffness in the joints, so it's hard to walk, get dressed, eat, brush your teeth, wash your hair. I mean, just everyday normal things that we all take for granted. It takes a lot longer for people with RA to get ready. Because it affects the body in that way, like with sports, it's hard to wrestle with my boys because I hurt. In fact, my boys call me the glass mom because they think that I'm so breakable because it hurts when I do certain activities, even to catch a football. So with that, then it can also cause a lot of depression because that person can no longer do what they used to do. So it's super, super, super important that family and friends understand the disease, and super important for that person who has RA to keep a positive outlook on life and just to kind of, I guess, accept the challenge, if you will, and prove the RA wrong. And that, you know what, I may not be able to do it the traditional way or how most people do it, but I can figure out a different way to do it. So that's kind of how I think about it, and I get through my day like that. So there are several things that you can do for the pain. Excuse me, like I mentioned before, diet has a lot of power. There's a lot of anti-inflammatory foods that you can eat to help keep the inflammation in your body down. Inflammation is what causes the damage in your joints. Let me show you my hand. This is my right hand. You can see right here, damage done, and then my first two knuckles. Get a good angle at that. They are really swollen, but this is damage that has already been done because I have had so much inflammation in my body. In the last 4 years is when everything started not working for me, meaning all the prescription drugs. So that is why I'm now like, you know, I don't want to put any more chemicals in my body. Let's see if I can do this with food. So I'm going to show you a couple of things that I have been taking. This is still very new to me, but one that maybe you've heard of is the fish oil, the omega-3 fish oils. This is the Wilderness Athlete brand, and my amazing boss actually at work bought this for me. He's a big hunter, and he uses a lot of the Wilderness Athlete products, and the omega fish oil is good for the heart health and it also reduces the inflammation. So I take 2 of these a day. And then also from the Wilderness Athlete is the Joint Advantage. And that one supports the healthy joint and cartilage function. So you can see that. You can go to wildernessathlete.com. They sell it online and they can ship it right to you. But I've been doing that and then eating a lot better and fitness, and it's been working so far. I would consider my disease pretty moderate to severe, and the last week it's gotten a lot better, so hopefully this is all working. Anyway, I'll be posting a lot more videos on my channel about meals, workout plans that are easy on the joints, great activities for the family, and just kind of my everyday life and how we all cope with the RA. RA is not standing in my way of life. I am not letting it get me down, and I hope that I can share that with everyone as well. So look for my videos, subscribe, share, and I look forward to talking to you soon. Mwah!